Hi, very good morning and welcome once again to Moorgate Andrology. Now in today's video I want to talk about penis fat transfer top-up. So what is a penis fat transfer top-up? So this is a minor surgical procedure to put more fat into the penis after someone has had already one fat transfer procedure done. Now, at Moorgate Andrology, generally, most patients only ever have one fat transfer. This is because in modern times, we have very sophisticated systems for purifying the fat, taking unwanted material out of the fat before it's injected back into the penis. This includes stuff like blood, oils and other debris that's extracted from the fat before it's injected back into the penis. And this increases the survival rate of the fat. So the kind of patients we tend to see at Moorgate that want a penis fat transfer top-up are either patients who have had a penis fat transfer many years ago and the fat hasn't survived very well, or patients who are wanting even more girth added to their penis from the first fat transfer. So let's discuss both of those options in detail. Now, if you had a fat transfer procedure some years ago, then back then the purification systems for the fat were not available, and there were very high absorption rates of the fat. So we tend to see patients coming to us who had, penis enlargement surgery over 10 years ago, and they want to come back to add more fat because a lot of it had disappeared. And of course, this is quite possible. If you have the donor fat or a little bit of donor fat on the belly or the inner thighs, which are the areas where the fat is usually taken from, then indeed you can have another fat transfer. As for the latter group, these tend to be patients who are looking for something, shall we say, a little bit special. They know that they're going to get an increase of around 1 inch to 2 inches with one fat transfer procedure. And don't forget, this increase in girth is there flaccid and in the erect state. But this group of patients want more. They want something where they have what I would call super girth or maximum girth. And they come back typically between around 6 and 12 months after the first procedure to have a repeat fat transfer. Now, in these cases, this penis fat transfer top-up gives a very significant girth to the penis, both in the flaccid and erect state, and the penis can look very big after having 2 fat transfer procedures. Still, with a second fat transfer top-up, there will be some absorption. There's always some absorption of the fat that is transferred. Typically, this is in the region of around 30%. But even after that 30% absorption, the remaining 70% of a second fat transfer does add significant girth to the penis. So if you're looking for this super girth, if you're looking for significant girth to your penis, then you could consider not one but 2 fat transfer top-up procedures. And again, if you had a fat transfer several years ago, but perhaps things aren't looking as good as they did in the very beginning, then you could investigate having another fat transfer procedure, but perhaps this time with the added advantage of these new, very sophisticated and excellent purification systems that are used now in fat transfer generally. So that's all from me. If you're looking for more information about penis enlargement surgery, including a fat transfer, then please visit our website www.moorgateandrology.co.uk and get in touch with us, and we'll arrange a consultation for you with one of our urology specialists. Until then, I look forward to seeing you back here at Moorgate very soon. Bye for now.